Hi, you're welcome to Rehoboth Pediatrics. Today we are going to learn how to take care of a preterm baby. Okay, remember the management of a preterm baby is based on the various complications they are likely to encounter. So number one has to do with respiratory support. This basically happens in the hospital whilst on admission, where we put them on oxygen support through what we call continuous positive airway pressure. Number two is temperature control or thermoregulation. So whilst on admission, we put them in incubators or under radiant warmers to help them control their temperatures. Also, the mother will be taught how to practice what we call kangaroo mother care or skin-to-skin contact. And we'll discuss KMC or kangaroo mother care into details in our subsequent videos. And then upon discharge, we expect that you dress the baby in overall dresses, or they have to wear gloves, caps, and then socks as much as possible. You keep them well wrapped up to prevent loss of heat into the atmosphere. And then also try to keep their rooms warm as possible to prevent the baby from going cold. Okay. And the other very important management for preterm is about their feeding. So it starts all the way from admission, where you are taught how to either breastfeed, which most of them are unable to do. So we would have to pass a tube through their nose or their mouth to the stomach, through which we will be passing most of the breast milk. Then whilst on admission, we teach the mothers how to do cup feeding. So before we discharge, we make sure that every baby or mother is able to feed their babies completely through cup feeding, at least if the baby cannot even suckle. Okay, so whilst in the house, the mother is going to continue with the cup feeds, and preterms are supposed to be fed at 2 hourly intervals. So we teach you how to even graduate the feeds as the days go by, so that your baby gains appropriate weight. And then the other thing has to do with infection prevention. Remember, we said that their immune system is not well developed. So if you don't manage them well, they are at risk of developing infections and subsequently dying. Okay, so as a mother, before you breastfeed your baby, you make sure you wash your hands with soap and water, rinse it very well. You make sure you bath twice a day. You make sure you clean your breast, especially around the areola, before you breastfeed. And then also the cups that you use to feed them. Okay, make sure you wash it after every feed and rinse it in clean water and keep them in warm or hot water, so that the bottles will be well kept for the baby to prevent infections. Also, you try to avoid crowded areas, as they will be exposed to respiratory infections in crowded areas. And then also, don't forget that they are supposed to complete their immunization. So in my hospital, for instance, preterms are supposed to be attending what we call prematurity clinic, where they are supposed to be seen every weekly at least. Okay, so that will monitor their weight, their height, their head circumference, examine them thoroughly to ensure that they are growing appropriately, and then to ensure that they complete their immunization schedule according to plan. And then we also talk about skin care. Okay, so with skin care, we advise that you bath preterms only with clean water, without soap. You don't apply any strong scented perfumes, powders, or pomade, as these can be absorbed through the skin and may be dangerous to the developing organs of the preterm. So you realize from the discussion so far that the management of preterms is technical and demands both specialist care and strong family support to ensure continuity of care even upon discharge. This is the only way to ensure the survival of the preterm baby. Please like and share our videos as we create awareness together. Thank you.